So let us continue the Nash therapeutics study streak. Today is 11th Jan 2025, and we have covered a lot of remedies so far. And I guess if you are reading the leaders in homeopathic therapeutics simultaneously before, after the lecture, anytime, it's going to be immensely beneficial. So, all the homeopaths who are beginning in their practice, who have already set up their practice, or who want to, learn, even though you have a settled practice and going good so far in your clinics, and you want to still go back to basics. So, Dr. Nash was one of the authors whose book everyone should have on their desk. And I recommend that if you are a homeopath, you should go through the same materia medica again and again every year, because your perspective towards that remedy and that materia medica will change every time. So maybe once a year or once in 2 years, you should go back to the same materia medica which you have read few years ago, and you will learn something more about the same remedy which you have read earlier, the same book which you have read earlier, and the same author who has guided you earlier. So we'll continue with Nash therapeutics today, and it is the day of learning where we'll cover three remedies: Sepia, Murex, and Lilium tigrinum. We would have taken up more remedies, but Sepia as a remedy is around a very large remedy written by Dr. Nash. And to, you know, cover it beautifully, we kept it only three remedies for today. But maybe next time we would have to cover 5 or 7 remedies at a time. So all these three remedies, Sepia, Murex, and Lilium tigrinum, are more or less interrelated, and I'm happy to see so many of the uh, homeopaths who have joined the Instagram live. Shreya has always been there. Ritesh Sheth, uh, then Dr. Lekha VMS, Free Spirited Girl. Dr. Divya is always there supporting our posts. And let us continue the journey with the three remedies today: Sepia, Murex, and Lilium tigrinum. So, what does Dr. Nash tell about these three remedies? And the first remedy that we'll pick up is Sepia. This is one of the wonderful remedies of which the dominant school knows nothing except that they have learned from us. So, Dr. Nash kind of gives us an idea of how this remedy is something that homeopaths discovered and allopaths learned from us. And there are many remedies which we learned from them. There are many remedies which they learned from us. But this process stops here, and they don't reciprocate for any other thing, or give us the credit for any other thing, which is okay, because science takes time for validation and we need to keep doing our work. So, what is interesting about Sepia? Dr. Nash shares that in Sepia there is this female abdomen and pelvis. These are the three structures that are profoundly affected in this remedy. And we will see that uh, no other remedy produces stronger symptoms here, according to Dr. Nash. And then he goes on to quote around five authors and one small paragraph each for all these five authors. What does he say? He quotes Dr. Hahnemann, he quotes Dr. Gunsi, he quotes Herring, he quotes Lippe, he quotes Dunham, and he tells us, after quoting five authors, one small paragraph each, it can be three-line paragraph like, and he tells us that there is a kind of a no higher authority than the united testimony of these five of our best observers could be brought to show the action of sapia upon the pelvic organs. And he gives us these proving related symptoms from Allen's encyclopedia, which is what are very important for each homeopath to refer. So there are very few materia medica which quote exactly the proving symptoms in their literature, and Dr. Nash is one of them. Although he quotes just two or three lines or five lines, but these lines are the prime most important for that remedy for us to understand, and this is how the patient is going to talk with us in the clinic when they present their complaints. So that's why Dr. Nash quotes us these lines verbatim from the provings to his materia medica, to his therapeutics. And leaders in homeopathic therapeutics is all about that. He quotes little bit of philosophy, he quotes little bit of materia medica, he quotes little bit of his experience, he quotes little bit of the case that he saw, he quotes little bit of the potency that he used, and he quotes about the repetition, he quotes about which remedy follows the other remedy well. It can be interspersed across the entire remedy, you never know. So it's like a box of chocolates or box of surprises which opens up. It's a small book but worthy of note for each homeopath. So for sapia, he gives us the details about the provings of the different authors, the provings which Dr. Hahnemann did, and he tells us the potency which he used in the provings and what we should do as a clinician in our practice. I would recommend everyone to go and read this book to understand this paragraph better. But going further, Dr. Nash describes the kind of a relation between sepia and sulfur together, how they are very much closely related, how they are having similarities in general circulation very much marked. And Dr. Nash tells us further that sepia, like sulfur, has flashes of heat with perspiration and faintness. The only difference is that sepia is going to have with pelvic symptoms and especially with or without climatic symptoms. So that is what we always want as a homeopath, to compare one remedy with the other so that we know when to give which remedy. The biggest challenge for a homeopath is when to give which remedy. And if you read Dr. Nash's Leaders in Homeopathic Therapeutics, this aspect of when to give which remedy gets fine tuned. There is irregularity. This is one of the key important areas which differentiates sepia from sulfur. What Dr. Nash tells us further is that there is a kind of an irregularity in distribution of the flashes of heat. For example, sometimes the hands are cold, sometimes the legs are cold. Sometimes their legs are hot and the hands are cold, and vice versa. And there is no burning. Whereas in sulfur, we see that there is lot of burning. So this is the major compare points where both the remedies diverge. And if you are a homeopath who want to kind of also connect it with the presenting symptoms of the patient, then pelvic symptoms presented by the patient would give you an idea that it is in connection with the irregular distribution of heat and irregular distribution of the flushes of heat which is going on. And what goes further to tell us further about the remedy sepia, Dr. Nash tells us that the pelvic congestion is mostly due to the actual displacement of the organ. So it can be a large fibroid, it can be a large cyst, it can be a large swelling like a prolapse which is not in its place. Something that is not in its place indicates sepia. If you remember this, your job to prescribe sepia becomes easier. And that's why you have the rubric rest cannot when things are not in proper place, or the remedy is fastidious in nature. So it needs to put things in order, it needs to have things in order. Only then it can perform efficiently. Once that disorder is there, it gets into confusion, gets into disorder. And this displacement or irregularity is seen everywhere from the mind to the local organs to the urinary tract to the rectal tract, everywhere. So Dr. Nash tells us that similarly, what we see in pelvic areas, there is displacement. In the urinary organs also, there are pressure and fullness. The urine is offensive, there is frequent micturition, and there is this irregularity of passage of urine all the time which is there. And then Dr. Nash compares further the remedy sepia with male organ issues, and he compares kali iode and capsicum about where you can give which remedy. Sometimes he has given sepia, sometimes he has given kali iode, sometimes he has given capsicum, and so on and so forth. So all those who are willing to ace up their practice with some nitty gritty things about the differentiation of these remedies can definitely go to leaders in homeopathic therapeutics by Dr. Nash. Going further, Dr. Nash describes the mind of sepia as a person. They cry frequently without knowing the reason why, which is what we see in pulsatilla. Dr. Nash describes exactly similarly that it is seen in pulsatilla also. But in sepia, it becomes so intense and chronic in nature that patient becomes indifferent to her work and the people around. There is hemicrania with uterine troubles. There is drooping of eyelids like causticum sepia, causticum gelsemium, and sepia is the third remedy of its kind. And he gives us a case of the nasal catarrh where pulsatilla failed and how sepia helped. So, there are chronic troubles which keep on troubling some people for a long time. Complaint is there since 4 years, 5 years, 7 years, 10 years. Think of sepia as a remedy. It is going to help in such cases. Going further, just like yesterday we took up the remedy phosphorus, Dr. Nash described phosphorus in around 8 to 10 pages. Similarly, sepia is described in around 8 to 10 pages, and no wonder these both remedies are kind of complementary to each other. So, Dr. Nash tells us that in the gastric sphere, there is a goneness or emptiness which we saw in Ignatia, Hydrastis, Phosphorus, and some other remedies. And everything kind of goes on dragging towards the pelvic cavity, and this causes the emptiness or goneness feeling in the gastric region. And further, Dr. Nash compares sepia with murex about this goneness or emptiness, sepia with stannum met and lilium tigrinum, and sepia with selenium in terms of constipation. He gives us a case of enterocolitis, since he is describing the gastric tract. He tells us that how two allopaths had failed, and how he observed a peculiar symptom in the patient which is worse after taking milk, and two eminent allopaths who failed, Dr. Nash coming into the picture, cured the case and it helped him a lot. So Dr. Nash tells us that in all such cases where there is worse after taking milk, think of sepia as a remedy. And then he goes on to compare entim crude in cases of oozing of moisture or some discharge in the anal region. Next we have is the general description of sepia which Dr. Nash gives, and this goes like: sepia is very weak. It faints from easily from least extremes of weather. It can be heat or cold. It can be some trifling occasion. It can be any overwork which is done. And this is the reason sepia is called as the washerwoman's remedy, because the laundry work which the washerwoman does tires her so much that she doesn't have the energy to do anything else. And that's why sepia is suited to such people who are all the time busy or dragged in the routines, do not have time to do anything else, and that is where sepia is indicated. He tells us that if sepia is a remedy for washerwoman's case, then phosphorus is a remedy for washerwoman's toothache. Now, what does he mean from that? Is for us to unlock. But what is interesting is that he gives us this comparison of sepia being a remedy which is suited to the entire disturbed constitution of a washerwoman, whereas if it is a local complaint which the woman who is overworking comes to you with, especially tooth, the remedy is phosphorus. And then he describes the skin. Dr. Nash tells us that sepia as a remedy is very much similar to sulfur in its all its presentation: itching which leads on to burning, and especially there in the bends of the elbows, knees, etc., etc., all types of complaints of skin troubles, herpes, and deviated skin textures should be the place where sepia is applied, and it is complementary with sulfur. So all the cases where you have given sepia, give a dose of sulfur in between and give sepia. In fact, what I have seen is that all the cases of ringworm, which probably are of the most obstinate kind, I have given them a dose or two of sepia in between the constitutional treatment or the indicated remedy, and the case kind of begins to move forward towards cure. So, this is a valuable tip which I share from my own experience. If I have given sepia as a constitutional to some patients, especially skin troubles, ringworm or herpes or psoriasis, and the case has got stuck up, sulfur as a intercurrent remedy has helped unlock, and then going forward, sepia is helped. So this kind of a complementary relationship between two remedies is what we see in homeopathy, and especially with such scenarios of skin troubles. And Dr. Nash ends the section of sepia by telling us that he does not believe in incompatibles like phosphorus or causticum or silica and merxol or rustox and apis if he founds them indicated one after the other. So all those who are fearing that this remedy should not be given after this remedy should give a second thought, because if Dr. Nash found them useful one after the other, phosphorus after causticum or vice versa, then why might as well we can try this and find this out in our clinical practice. Next remedy which Dr. Nash shares with us in his book Leaders in Homeopathic Therapeutics is the remedy Murex. He tells us that this remedy is closer or nearer to sepia, and sexual desire is what differentiates from sepia, Murex has a high sexual desire, whereas sepia has a low sexual desire. This can be a direct question to certain patients if you feel that everything is matching the picture except a few things, and then this can be a deciding factor to decide between sepia or murex. There is a sinking sensation in murex as well, and murex has a kind of a sore sensation in uterus, like the Helonia's remedy, and as if it is conscious of the womb. Something is going on in the body. Again, he compares murex as a remedy for high sexual desire with platina and lilium tigrinum, and he ends the remedy murex by telling us that these are the trio of nymphomania which he wants to share with us. So, lilium tigrinum is the next remedy which Dr. Nash picks up. It resembles sepia in its action on uterine organs. No wonder he has written sepia, murex, and lilium tigrinum in this order, because they are more or less interrelated. Weight and feeling as if the pelvic contents would pass out through the vagina, or if not prevented by the pressure of hand. And there is no remedy more efficacious for uterine displacement than lilium tigrinum, is what Dr. Nash proclaims in his Leaders in Homeopathic Therapeutics book. He also warns us that the choice between lilium tigrinum and sepia might not be easy. And he gives, like I have earlier also shared, a kind of a table with comparison of multiple remedies that Dr. Nash does. Those who are watching on YouTube, Homeosetu YouTube channel, can easily find this table. Those who are watching on Instagram will just see me talking. I'll be putting up the recording of this table particularly later on in some excerpts. But what you see is in Lilium tigrinum and Sepia, there is a kind of differentiation which Dr. Nash mentions, and this is not there in the tabular form in the book, but I have prepared it especially for a good visual appearance, which is very important. Lilium tigrinum has more of intense and painful distressing condition, whereas sepia has more of a chronic and lingering problem that is going on since many years and months. Lilium tigrinum may not have the cachexia or emaciation. The patient may be well healthy or plethoric or plumpy, whereas sepia has cachexia and emaciation. In Lilium tigrinum, the urinary irritation and distress is more like cantharis. The complaints will all be centered in that area. But in sepia, it's going on since a long time, not much bothering. It is there, but it is not acutely felt like that in Lilium tigrinum. And again in Lilium tigrinum, what Dr. Nash shares with us is that rectal irritation and distress is very much strongly felt in Lilium tigrinum. But in sepia, it's a chronic thing and it's not much of a bother. But you will see that in all the complaints, it is going on since a long time. It can be for years long. And Lilium tigrinum will acutely make you feel that I am not feeling good and give me help immediately. This is the most pressing symptom for me in my body right now. Lilium tigrinum will be this indicated for you all. Last but not the least, Dr. Nash tells us that Lilium tigrinum has uterine and heart complaints, and what we see in sepia is that sepia has uterine and head complaints. So all the cases which report to you with some fibroids or cysts or uterine troubles with some sort of palpitation or heart related or heart region complaints, think of Lilium tigrinum very strongly. But on the contrary, if the same uterine complaints are there with lot of head complaints, think of sepia, headache or headache with uterine complaints. Again, Lilium tigrinum has cactus-like symptoms, which is what Dr. Nash tells us. Sensation as if heart were constricted by iron band. and he has given cactus many times only to come on to Lilium tigrinum later on. So it's not a remedy only for the female reproductive system, but also for the heart region, is what we see from the reading of region leaders in homeopathic therapeutics by Dr. Nash. Now, just the last part, and this is a beautiful pictorial representation again for those who are watching on YouTube, Homeosetu YouTube channel. If you are on Instagram, I'll be putting up a small excerpt later on about what this part is about. Lilium tigrinum, everything starts from the uterus, and then the reflex symptoms are seen on the heart or urinary organs or rectal organs. So patient will present to you with urinary troubles, patient will present to you with rectal troubles, patient will present to you with heart troubles. But you will see that in the past they have suffered, or they are still suffering with a mild form of uterus affection or uterine affection. So that complaint of the uterine origin or uterine affection reflects to the other organs of the body, and that is where the problem of heart, urine, or rectal region started. And he concludes by telling us that Lilium tigrinum is like pulsatilla in weeping, or such a mild yielding personality. She doubts her salvation like Veratrum, sulfur, or Lyco, and she is hurried like Argentum nitricum, very much wanting to finish all the work all the time, which is what we know from the various rubrics, of course. But this is the materia medica part, which Dr. Nash tells us. And what we see is that although the Lilium tigrinum remedy is hurried like Argentum nitricum, both the remedies are unable to perform them. So this is an interesting learning for us, and we will be able to differentiate both the remedies on the level of physical symptoms or physical generals like sweets, desire, or fear of heights, or in Lilium tigrinum, some heart sensations, uterine troubles, etc. etc. So, we come to an end of today's session, and we covered three remedies: number one, sepia; number two, murex; and number three, Lilium tigrinum. Let me know in the comments if you have liked this video, and if you are reading Leaders in Homeopathic Therapeutics by Dr. Nash. Follow Homeosetu channel on WhatsApp, Instagram, Threads, Facebook, YouTube, and Twitter, which is now X.